Hello and welcome all. Good evening. Welcome to this session. The session is on a topic of anatomy, and today, just a second guys. Today we are going to start on a topic from the upper limb, and the topic of discussion today is the pectoral region. Pectoral region part 1. I welcome all of you. My name is Dr Ankit Khandelwal, MBBS MS Anatomy, and you are anatomy educator in Unacademy. Let's start the session. Few things before we proceed further, and these are some benefits over here for the Unacademy students. It is a calendar month for the month of that calendar for the month of March. So from March 21st, we have all this test series up till March 27th. This is for the whole week. Every week, daily, you are having so many tests: subject tests, image-based, grand tests, subject-wise, topic-wise, everything. So you can catch a hold of this. For example, we have this orthopedics test on 21st, 22nd we have medicine, then pharma, then mixed bag, then anatomy, then mixed bag, then NEET PG, all these tests going on. Let us see the few points. This is all India mock test. Mark your calendar, 27th of March, morning 9 a.m. 27th of March, morning 9 a.m. Remember, that is all India mock test. So you can use the code Dr Ankit Live to enroll and to register over here. These are some of the benefits of Iconic, and another marathon batch, which is going to start from March 23rd for 2 months. That is a high-yield MCQ marathon for NEET PG. One more batch for the FMG for 2 months, FMG revision and MCQ batch. Then we also have this NEET PG subscription. Apart from Plus and Iconic, which most of you must be knowing, NEET Unacademy started another one as a light subscription. Light means not in depth of, not enclosing all the classes and sessions, but some of the tests and other things are available in the light subscription. Okay, and get a hold of that also. Now coming to our topic. The topic for discussion today is the pectoral region anatomy. Pectoral region anatomy is the topic. Let's start the session now. How to proceed? Here in the first picture you are seeing some of the bones. Now we'll go from superficial to deep, whatever region we are going to discuss. But just over here is just overview of all the bones and the region which defines pectoral. Pectoral is a region front of chest. Front of chest is not inside the ribcage, inside the ribcage, and ribcage itself is a part of thorax. So it is outside the ribcage, remember that. So it encloses the bones of the upper limb, which are the clavicle in the front, scapula behind, and part of the humerus laterally. And then mixture of the exoskeleton also, like the sternum over here and the ribcage, but externally. So this whole area outside is the pectoral region. Remember, axilla is separate from pectoral. Pectoral is only the front part. It's only front part. So just giving you a brief idea, the location of the pectoral region. Now what we are going to discuss over here, understand that part. Pectoral region, when we say, should know what is a region. The structures over there, important structures are, we should know a little bit of the skin and its nerve supply in the pectoral region. Then we should know about the fascias. Why do we need to know? See, tomorrow if you are going to do a surgery, you need to cut through the skin, then you need to enter that area. You need to know parts of important points from fascia. Then we need to know what are the various muscles, because it is mainly made up of muscles over there. What are the various muscles in that region? And when we are saying fascia, there are some important fascias also over here. So let us start. The skin over the pectoral region, what would be the cutaneous supply? I can see the comment box also, you can write something over here. What is the cutaneous supply in the pectoral region? If someone touches, pain, touch, temperature, pressure, vibration, all that, cutaneous sensation in the pectoral region, which nerves are there in the pectoral region? Obviously, there are the cutaneous nerves. So it is a mixture. Actually, it is a, you can say the bridge between the thorax and the upper limb, the pectoral region. So cutaneous supply in the pectoral region are basically the upper thoracic spinal nerves, upper thoracic spinal nerves, their branches. Which branches? The anterior and the lateral cutaneous branches of the upper thoracic spinal nerves. Upper thoracic means mainly T2 to T6. Why T2 to T6? Because remember, C5 to T1 has gone into the upper limb. Basically, T2 to T6 are there in the trunk or the thorax part. Thorax part skin is a component of pectoral region only. I told you it is like a bridge. So they are cutaneous branches. But only these, you can also write in the comment box if you wish to. Any other nerve you can think of which is supplying cutaneous apart from these T2, T6, I told you T1 gone in the brachial plexus, C5 to T1 gone. What is above C5? Above C5 we have the C4, C3, like these nerves C2. So these nerves C3, C4, they will form supraclavicular nerve. They are actually a part of the cervical plexus, but they are cutaneous, supraclavicular. They go over the clavicle and they come in the upper part of the pectoral region. They supply over here. Supraclavicular nerve, that is the area. And below this, the thoracic part. So we should know about the cutaneous supply over here. I am just showing you over here. Supraclavicular nerves, mind you, they roll against the clavicle over here. So remember that part. This is a very important anatomical part. And the other part of pectoral region are upper thoracic spinal nerves. They are anti and the lateral cutaneous branches. That is a part of the skin. Now, let's go deep. After skin, if you remove the skin, you will obviously see the fascia. What are the various fascias over here? Fascia, and what do we need to know about the fascias? Few important salient points only. Fascias we all have learned: superficial fascia and a deep fascia. Clear? Superficial fascia and a deep fascia. Superficial fascia mainly contains fat, and obviously then vessels, nerves, lymphatics and nerves. Main content is fat. So remember over here, when we talk of the superficial fascia in this region, when you talk of superficial fascia, it is actually continuous. The superficial fascia in the pectoral region is continuous with the superficial fascia of the neck, of the abdomen part, and also the pelvic part, because the fat over there is continuous. The superficial fascia is continuous. There is nothing specific over there, but one of the major structures, most important structure, which I am going to discuss in the next session, is present in the superficial fascia of the pectoral region. Which structure is that? Anyone wants to comment, please do. There is a very important structure, organ lying in the superficial fascia of the pectoral region, that is a mammary gland. So remember, that is a totally different, separate topic in itself, because that is a huge topic. Mammary gland lies in the superficial fascia, remember this. Mammary gland, no, but sir, that is only in females. No, it is present in both male and female. In male it is a rudiment, but it is present. Anatomically it is present. So mammary gland is a content of superficial fascia. Then it is continuous, fine with the other parts. We go deeper, then we see the deep fascia. Deep fascia over here. Now deep fascia, remember, when we talk about the word pectoral region, the first thing that should strike your mind is this important big muscle over here, that is pectoralis major. And the fascia which covers this muscle is pectoral fascia, that is the deep fascia. So remember, the deep fascia is the pectoral fascia, right? So that is covering the muscle. But sir, is that all? Wouldn't it be attached anywhere else? Obviously it would be attached to various places. We will see that also. A very important part of this deep fascia is the clavipectoral fascia, by which we will come to in detail. But let's move forward from the pectoral fascia. Now pectoral fascia, the deep fascia. Now deep fascia, if we go to the general anatomy part, the characteristic of deep fascia which differentiates it from the superficial fascia is that the deep fascia is attached to the bones. Deep fascia is attached to the bones. Obviously it is covering the muscles are attached to the bones, so the deep fascia also attached to the bones, common sense. If this is, imagine the bone, and the muscle is coming out of it, and it is covered by a fascia, that fascia, won't it be connected to the bone? Obviously, yes. So yes, deep fascia is connected to the bone. Now which bone? Now pectoralis major is attached to which bone? Clavicle, sternum, ribs. So yes, the pectoral fascia will be attached to these bones also. Attachment of deep fascia, remember always, that is a thumb rule. Now this is a thumb rule. It is not something relevant to deep fascia over here only, everywhere, anywhere. Take anywhere deep fascia in the neck, thorax, upper limb, lower limb, attached to the bones always. Thumb rule, remember. So that is attachment to the bones, deep fascia. Now the pectoral fascia, you just imagine, it covers over here, then where does it go? It goes to the axillary region. It forms the axillary fascia. So remember, the pectoral fascia, I am just writing P dot fascia over here. It is continuous and it forms the axillary fascia. Remember over here, fascia I have not written the word sheath. So I will write in bracket over here, not the axillary sheath, so you don't get confused. Axillary sheath, some other day we will discuss in detail, but I am just telling you an MCQ over here. This sheath is derived from the prevertebral fascia. Just remember that part, okay? So pectoral fascia continues the axillary fascia. Then what happens? It goes posterior. Now posterior, which muscle is there? If I talk about the anterior, we have the pectoralis major. What is the counterpart of this muscle present posteriorly in the mid and the lower back? Latissimus dorsi. So yes, this fascia will also cover the latissimus dorsi. Or remember, it is attached to the bones also. So it's a deep fascia. It is a thickened fascia. That is our pectoral fascia, the deep fascia. Now this deep, we'll see, when we see the muscles, we'll understand one more fascia, that is a clavipectoral fascia. We'll come to that. But remember, for the time being, that you've cut the skin, you have seen the fat, removed it, then you have seen the deep fascia, fine. Now you are entering into the muscle department. Now what are the various muscles over here? Let's see from here. This is just an image from a textbook, and that is showing you the big huge pectoralis major muscle all around over here, attached to the clavicle, sternum and the ribs, right? And this muscle is a deltoid. It is not a part of the pectoral region, but yeah, a point over here is shown, that is, this is the deltopectoral groove, and the vein runs over there, is a cephalic vein. Please do remember this. It is a subcutaneous vein. So, okay, so this is, if you just slightly abduct your upper limb, you will contract the deltoid, right? And then you see this groove, deltopectoral groove. The cephalic vein of all our body is running over here. The blood is carrying the blood in this direction. Remember this part. P major, we'll come to it more in detail. Yes, P major, we'll come to it. So P major, now we'll come to the muscles in the pectoral region. We talk about skin, superficial fascia, deep fascia. We'll come to clavipectoral also, but now we'll come to the muscles. Muscles, basically 3 muscles are there. Please make a note of it. Mainly 3 muscles is what we are going to discuss, and in them the most important ones are the P major and the P minor. One muscle that is anatomically present, so obviously we'll discuss about it, a little bit of it, that is the subclavius. These are 3 major muscles present. P major, the most important muscle. P major, as I told you, already showed you over there. It's a muscle coming from clavicle, sternum, ribs. Where it is going? Where it is going? See again, where it is going? It is going to the humerus, the lateral lip of bicipital groove. So remember over here, this muscle, P major, it comes from the clavicle, from the sternum, from the ribs, medially, and then it goes where? It goes laterally into the humerus. First of all, humerus, where in the humerus, the lateral lip of bicipital groove. Lateral lip of bicipital groove. Just keep on imagining this. Forget about what is written on the screen. Just have a look over here. Now imagine the P major of my right side is coming from this side. It is taking origin from here, then it is going to the lateral lip of my bicipital groove. So which joint it is crossing? The shoulder joint. So when it contracts, what will happen? When it contracts, it will bring my arm closer, adduction. Then when the clavicular fibers will contract, it will also flex my arm. And when they will contract, it may rotate also. Now what is this rotation? When the anterior surface of my arm is rotating medially, medial rotation. So remember the 3 basic actions. This is how we learn the actions of muscles. Not by cramming them from the book, but just looking at them grossly, you got the answer. So the main actions of the pectoralis major are that it is adduction for the humerus, it is flexor. Now the whole muscle is not flexor of the flexion at the shoulder joint, but only clavicular fibers. So in flexion, I'm writing CL dot. And also for the medial rotation. Medial rotation, not a very big action, but yeah, that is present. But there's one more action. Please understand it. Now what happens is, supposedly, arm is flexed. This is flexion, that is extension, right? Suppose arm is flexed. Now I want to extend my arm against a resistance. Understand? I want to extend my arm against resistance. Suppose there is something kept below this arm and I am trying to extend it. Once you extend this arm, this arm is being pulled back or not? Arm location is this. Now you are trying to pull it back, or basically you are trying to make move arm back to the neutral position, then go back. Okay, now going back is later on. First of all, you are bringing the flexed arm to the neutral position, then only you will go back. So bringing the flexed arm or extending the flexed arm against resistance, again this muscle fibers will be known. Now which muscle fibers? The sternocostal muscle fibers. Which muscle fibers? Sternocostal. So remember one more action over here, and I will write over here separately that it is also used in extension of a flexed arm, of not a normal neutral arm, extension of a flexed arm. Normal arm, if you flex it, that is done by what? That is done by the muscles present posteriorly. Getting a point? That is done by muscles like latissimus dorsi. That will do this action. So extension of a neutral or neutral position arm, that is done by LD, latissimus dorsi. But extension from a flexed position by the P major. Extension of a flexed arm, that is important. That also against resistance. Against, you have to put some resistance, else it will happen by its own for the gravity part, by the gravity, right? So extension of a flexed arm against resistance is done by the sternocostal fibers of the pectoralis major. Remember this extra point over here. I hope you do remember this. That is logical. That is Pretty much logical, right? So these are some of the actions. Now let us look at some few figures over here. It will help you in understanding. All the things are already sorted out, I guess. The bones are shown. The pectoralis major attachment on the clavicle, sternum, and over other ribs is just shown over here. That it takes origin from all over here, and then it will go laterally. The lateral lip of bicipital groove. Remember, lateral lip of bicipital groove, not the medial lip, not the floor. Medial lip will have the teres major. Teres major. Floor will have the lady, latissimus dorsi. Lateral lip will have the P major. So remember, the mnemonic is the lady between two majors. Mnemonic, I hope you do remember. Mnemonic is always lady between two majors. So there were two majors and there was a beautiful lady, and both the majors fall in love with that lady. So just remember the mnemonic. Lady is a LD, latissimus dorsi. The major which was present laterally was pectoralis major, and the major which was present medially was a teres major. Just remember that, right? So that is a attachment of the pectoralis major. Beautiful figure over here. Now there is a small twist in the discussion. What is that? That the attachment, the fiber. Now there's a what is a issue? Where is a differentiating feature over here? That the origin of the P major is huge, or the medial attachment is huge, while the lateral distal attachment is very small. So the muscle fibers have to twist. They have to twist. So the lower fibers which are coming from the lower part of the sternum and the costal part, when they will ascend up, they form an inverted J shape, and the lowest most fibers, they are attached most superiorly. The origin of the lowermost fibers, when it gets inserted into the lateral lip of bicipital groove, the lowermost fibers, they are attached most superiorly. Now why is that, sir? Why is that? No. Why is that? For that, let's understand why is that. Now look at the right side. Let me just erase this point over here. Now look at the right hand as present, sir. Abduction, overhead abduction present, sir. This is normal. Normal, here you are seeing the twisted fibers. Yes or no? Seeing the twist. Now when the arm is abducted, hyper abducted, you can imagine now that when the arm is hyper abducted, this upper end of humerus is now lower down, and the part of the humerus that was lower down is now upper. Are you getting a point? So which was initially, now if I make a point over here, this is a point, that arrow, these two red arrows, they are at the same point. Imagine. Now this red arrow is on the upper attachment of the P major. It will be having the lowermost fibers. Same happens over here. Why this? Because when you abduct, the upper one goes below, and this is why the reason we have twisted fibers. So when you abduct, when you stretch the fibers don't twist around each other. So now it is normal. It is looking normal. In a flex position, it's a normal position. It is looking like this. I hope you got the point. The basic reason behind twisting. Okay, that is the reason behind twisting. Let us see more over here. Yes. Now, once you cut the pectoralis major, the point over here is, if I take a scalpel and I cut this line from here, from here, from here. This is normally what we do in a DH. And then I retract this whole muscle laterally. And what I am going to see behind the P major. Behind the P major, what I am going to say is this P minor. This muscle over here is P minor, pectoralis minor. It is coming from the scapula, the coracoid process of scapula, to the third, fourth, fifth rib, or second, third, fourth rib. That is a deep. Here you have to imagine that the P major has been sliced out to show you the deeper place P minor. Okay. Now remember, both P major, P minor, the pectoral nerves will supply them. Obviously, P major is a huge muscle, so major is supplied by both medial lateral pectoral nerves. But this over here is normally supplied by only medial pectoral nerves. So just that point to remember. Now you have seen this muscle. I hope you will recognize this muscle later on also. And above this muscle, you are seeing the bone clavicle. This is C for clavicle. What is a small muscle below this? Subclavius, the third muscle. Yes or no? So this is subclavius. That is P minor. Clear? Keep on imagining the P major was here 5 minutes back. Just imagine. Now if you can imagine the muscle, you can imagine the P fascia, pectoral fascia also covering it like this, then going back, forming the axillary fascia, then the latissimus dorsi fascia. Now imagine over here that this gap between subclavius and P minor, this gap is not open like this. They have a fascia between them, and that fascia is known as clavipectoral fascia. That fascia is known as clavipectoral fascia. So there will be a fascia over here, which will be between the P minor and the subclavius. So when we say the word clavipectoral fascia, This pectoral word is not for major, it is for pectoralis minor muscle, remember. It is between the clavicle and the P minor muscle. Now this fascia over here, clavipectoral fascia, is actually covering the axillary vessels and nerve which will be lying posterior to the clavipectoral fascia. So it is covering them, clavipectoral fascia. Now this clavipectoral fascia will do one thing. Here you are seeing one fascia. As this fascia reaches subclavius, it divides into anterior, it actually splits and then it attaches to the clavicle. So subclavius is coming from clavicle, so this fascia will go above and then it will split and attach to the clavicle. From there the posterior fibers of the fascia may go to the deep thoracic fascia of the neck. Now what happens when it comes down? When it comes down again, it will split to enclose the P minor, both in front and back, P minor. Then what happens over here in the lower part of P minor? The fascia is again merging at the lower part of P minor. What will happen then? Then what happens? This continuation of this fascia will reach the axillary fascia which is over here. So clavipectoral fascia will split, meet, that will go down. It will meet the axillary fascia over here. Now this is a part of the clavipectoral fascia which is meeting the axillary fascia. It is known as suspensory fascia, or you can say also suspensory ligament of axilla. Because when we abduct our upper limb in a normal person who is of normal build, what we see is the concavity in the axilla, yes or no? We see concavity, not convexity, not a bulge but a depression. That depression is due to this suspensory ligament. Because when you are hyper abducting, overhead abduction, when you are doing the overhead abduction, the scapula moves. When the scapula moves, the P minor will move. P minor will help, yes or no? Because it is attached to the scapula. When this moves, this suspensory ligament will pull the axillary fascia. When it pulls the axillary fascia which was straight, it becomes concave. So what you see from here is the concavity. Right? So here we have seen a couple of fascias. We have seen the muscles also, P minor also, subclavius also, and the fascias also. Muscles, remember, we have to look at the nerve supply. The muscle has a medial pectoral nerve, subclavius supplied by the nerve to subclavius. This is again coming from the, you can say, the brachial plexus, the upper tongue of the brachial plexus. What is their action? Subclavius basically stabilizes the clavicle, and P minor, it will assist, it will help the serratus anterior in doing the protraction of the punching movement. So it helps, because imagine when this muscle contract, it won't normally be moving the ribs, it will be moving the scapula forward, and that front movement of the scapula is done by the action where you need a protraction of punching movement. Got the point? So that is the action and location and the couple of part of the, how to locate the fascia. Now why is this clavipectoral fascia important? Because I told you behind this you have the axillary vessels and nerve. So some of the structure, they will perforate this fascia to come out, or some structure will perforate to go in. So that we have to learn what are those structures. Now look at this picture over here. What is this picture? This is, now imagine I am standing like this, right? And you took a saucer and blade and you cut me like this in a parasagittal view. So if you see a sagittal section, not a mid-sagittal, but a parasagittal section like this, front what will you see is the P major. This is the skin part, right? Behind it the fascias, and then you have this is the superficial fascia, SF, then this is the deep fascia, DF, this is the muscle P major. This whole is a muscle P major attached to the clavicle. You can see this deep fascia, the pectoral fascia over here, goes over here like this. This becomes the axillary fascia. Now you can see the concavity also over here. You can also see the concavity over here, right? Now see, behind P major is the P minor. Below clavicle, subclavius. Between subclavius and the P minor is the clavipectoral fascia. Behind this you can see an axillary artery, just for the sake of understanding, but you have the veins also, the nerves also, the lymphatics also, all of that. And between the P minor and this axillary fascia, what do you have? The suspensory ligament of axilla. Understood the whole anatomy? Right? So this part is the clavipectoral fascia, what I showed you. In this image, it is only appearing like a thin line. But you have to understand that it actually is from the first rib medially to the scapula laterally. There's this whole spread out, that is the clavipectoral fascia. And there's also thickening between the first rib and the coracoid process of the scapula. There's a thickening of this fascia. See, the fascia is present throughout, but there is thickening of this fascia between the first rib and the coracoid. That is known as, remember, write it down, costocoracoid ligament. Costo is for the first rib, coracoid is the coracoid process. Costocoracoid ligament. It's a thickening of the clavipectoral fascia. I hope I'm clear. So remember a word, costocoracoid ligament, right? Let us see forward. Over here we have seen this. Now, clavipectoral fascia you have seen. Now, what are the structures which are piercing it? You can remember it by mnemonic CALL. Rare areas where we should use mnemonics. They are good for helping us to understand a lot of things. Anatomy is have to read and learn a lot of things in anatomy. I hope you all agree. So CALL, C is refers to the cephalic vein. Cephalic vein, remember, was lying subcutaneously. Now it has to pierce clavipectoral fascia. Why? Because when it pierces the clavipectoral fascia, then it will enter the axillary vein. A is for the acromiothoracic vessels. Acromiothoracic vessels. Acromiothoracic vessels or thoracoacromial vessel is a branch of the axillary artery. Now, when it is coming from here, it will come out because it has to supply the areas which are close to the lying superficial. So, it will come out. L is the lateral pectoral nerve. Now, I told you the pectoral nerves will supply the pectoral muscles. The lateral pectoral nerve mainly supplies the P major. So, obviously, behind the fascia, clavipectoral fascia, we have the axillary nerve vessels and artery, vein, and the nerves. So, the lateral pectoral nerve will come out and will supply the major, P major. This L is for the lymphatics. Lymphatics, yes. There are various lymphatics, obviously, the axillary group of lymph nodes. You have various lymphatics. Now, those lymph nodes, the various group of lymph nodes, they will pierce this fascia to go behind it and drain into the bigger lymphatics so they can ascend up and they can reach the location wherever the higher group of lymph nodes are located. So, remember this clavipectoral fascia pierced by which structures. These are very important. Okay, moving further, cadaveric image to show you over here. So, wrap up things. I'll just revise. First of all, have a look at this image. This image is a deltoid over here, not worried right now, but P major you can see, the clavicular fibers and the sternal fibers of pectoralis major. I hope you can recognize it very well. This is the clavicle, right? And this is the clavicular fiber, that is the sternal fiber, right? Now, can you see some nerves coming out over the clavicle? Remember what we discussed 15-20 minutes back? Supraclavicular nerves. These are the supraclavicular nerves, right? And this is a deltopectoral group. I hope you can easily figure out which structure is this, which vein is this. That is our cephalic vein. This is our cephalic vein over here, right? Cephalic vein. Now you can imagine that this is the clavicle. Scapula coracoid process must be somewhere over here, deep to the deltoid, somewhere over here, approximate idea. Sternum is obviously over here and the first rib is over here, right? P major is this. The P minor would be somewhat over here. Agreed or not? Deep to the P major, this is the location of P minor. So what is this whole fascia? If I just make it zigzag line, clavipectoral fascia. This is the location of clavipectoral fascia deep to P major. Between the subclavius muscle over here and the P minor deep, this is the clavipectoral fascia, and you can see the cephalic vein over here at this point is piercing the clavipectoral fascia to enter into the axillary vein. Got the point? I hope you understood by this, right? So what we discussed today, remember this, just to wrap up everything. We started actually discussing pectoral region. I hope for those who came late or joined late, the discussion today was the pectoral region. We started with the skin, its cutaneous supply and all that, and discussed the fascias. Fascias, remember, we talked about superficial and deep fascia. Important. Deep fascia has very other prolongations like the pectoral fascia, axillary fascia, then clavipectoral fascia, very important, clavipectoral, but we discuss it a little bit later because muscles have to come into play. Then more important are the muscles over here. The P major, pectoralis major, we discussed about this various attachment and actions. Then deep to it, P minor. Now P minor, remember, they can also ask you a question. It is a key muscle in the axilla because in the axilla region, the muscle is in the muscle of pectoral, but see, body is not like this is a blocks that you can easily divide. It's a mixture of everything. So, though it is a muscle of the pectoral region, but it's a key muscle of axilla. So that will also lie in the region of axilla. So this muscle in the axilla divides the axillary artery into first, second, third part, and it also divides the axillary group of lymph nodes into level 1, level 2, level 3. So it is a key structure in the axilla. Like piriformis muscle is a key muscle in the gluteal region. So second muscle of P minor and third muscle was subclavicular, and then we discuss the pectoral fascia. I hope you enjoyed the session, guys. This was all about the basic anatomy of the pectoral region. Hope you enjoyed. Any other points you have to ask, you can ask in the comment box. That's all from my side. I'll meet you again, remember, on Wednesdays. Today is Monday. I'll meet you again on Wednesday, day after tomorrow, same time. We'll discuss one more important content of the superficial fascia of the pectoral region, that is mammary gland anatomy. Okay, so hope to see you day after tomorrow. Till then, bye bye and stay safe.